North Carolina's top health insurer wants lawmakers to allow it to reorganize and create what's called a parent company. Blue Cross Blue Shield of North Carolina says the change is needed to help it compete with other big insurers in the national marketplace.
But critics are weighing in too, saying it could lead to higher rates and less coverage for millions of people in North Carolina. WRAL Capitol Bureau Chief Laura Leslie looks at both sides.
As North Carolina's largest health insurer, the nonprofit Blue Cross NC is heavily regulated by the state. 25 years ago, when it proposed becoming a for-profit entity, lawmakers rejected that idea and even passed a law to prevent it. Now there's a bipartisan push to roll back parts of that law. The bill would let Blue Cross move some of its billions of dollars in assets into a new nonprofit parent company. That parent company would own the insurer, but it would not be subject to the same level of state regulation. Blue Cross says the change would give it more flexibility to make investments and enter partnerships. The insurer was not available for an interview, but spokeswoman Sarah Lang said in a statement, "By modernizing our structure and outdated regulations for the first time in decades, Blue Cross NC can operate more efficiently, maintain its not-for-profit status, and better meet the needs of its members." Han Namkung with the NC Justice Center questions whether the move is truly needed. She said in 2021, Blue Cross had 80% of the state's individual and group health insurance policies.
I'd say that if you have 80% of the market share in your two most dominant products, you're doing pretty good as a business. My concern is that this restructuring is actually going to leave consumers with even fewer choices on the health insurance market.
State Insurance Commissioner Mike Causey is concerned it could lead to higher costs for health care. He says restructuring could allow Blue Cross to move its assets outside the state.
And we need to make sure that we've got the guardrails in place and that there's regulatory oversight, because these billions of dollars that have been accumulated by Blue Cross is money that came from the people of North Carolina.
Laura Leslie, WRAL News, Raleigh.
And Causey, who you heard from at the end there, is involved in talks with the bill sponsors and with Blue Cross Blue Shield. He's concerned it's being rushed and wants to have more discussion.